Okay, I think I can get started. Hi, everyone. Thanks for joining today's webinar. My name is Sandy Chen. I'm a Director of Data Management at Program on Global Aging, Health, and Policy from University of Southern California. In today's presentation, I'm going to introduce you the family of the LASI data. Just in the news this week, United Nations projects India to overtake China as the world's most populous country in April 2023. Also, the population is aging rapidly. United Nations also project that Indian over age 60 will double by 2050. It's almost 20% of the total population. So high quality data and comprehensive data is very important for policymaking and scientific advice. The good news is we do have 3 high quality data available for research community. We call them LASI data family. What is LASI data family? It contains 3 datasets. It's longitudinal aging study in India, LASI diagnostic assessment of dementia, we call it LASI-DAD, and real-time insight COVID India. In today's presentation, I'm going to give you an overview of these 3 studies. Then I will show you how to access and download the data and document. Lastly, I will give some example how to merge the data across 3 studies, and then give you some research example for research topic. Oh, by the way, I forgot to mention. So if you have a question, I will answer all the questions at the end of the presentation. Now, let's go into a detail of each study. LASI is a longitudinal study of more than 73,000 older adults in India. It was co-founded by NIH, Ministry of Health, the Ministry of Health, Family Welfare from Government of India, and United Nations Population Fund India. It's a joint project of the 3 institutions by International Institution for Population Science, Harvard School of Public Health, also University of Southern California. The Wave 1 data was collected during 2017 to 2019. The Wave 2 data collection just started this month. We started April 1st, 2023, and then we hope it will be finished by 2025. The sample contains age 45 and older adults and their spouse, regardless of the age. The data is representative is a national representative, and it is also representative in the state level. It was administered in 18 different languages. The LASI protocol is quite comprehensive. It was conducted in household level and individual level. The topic covered housing environment, household consumption, asset income, and insurance. For each individual, we collect the demographic, health condition, work retirement pension. We also collect the physical measures like blood pressure, vision test, and hearing test. One additional interesting component is we collect the dry blood specimen. The blood assay the data will be available soon. In addition, we also collect the information about the community, such as healthcare facility. Now, let me introduce the LASI-DAD study. LASI-DAD is an in-depth national representative study of the late life cognition and dementia in India. It was administered an enriched harmonized cognitive assessment protocol to a subsample of a little more than 4,000 LASI respondents aged 60 and older from 18 different states and union territories. The Wave 1 data was conducted in 2018 to 2020. For Wave 2, we are currently in the field. We started in December 2024, and we hope we are planning to be done by 2024. It was administered in 13 different languages. The LASI-DAD protocol is quite comprehensive. There are cognitive tests in informal interview. The protocol also including the health assessment, including the blood pressure, height and weight, hearing tests, the assessment for mental health, also nutrition status. In addition, we have a clinical consensus diagnosis. It was based on individual condition diagnosis. If the three condition diagnosis is in disagreement, then the consensus conference will be held. We also collect the venous blood specimen. The blood was sent to lab for analysis, and then the assay including HbA1c, serum-based assay, vitamin B12, and more. We also ask respondent to do the MRI scan. For wave 1, we have the scan for 137 respondents. The data is available on USC Image Data Archive. One very exciting component is genetics. The GSA assay was done for 960 samples, and the whole genome sequencing was done for almost 2,800 samples. It's the largest and most comprehensive genetic database from the South Asia. Our protocol also including the GPS-based information. We use the satellite data for pollution estimate, and then for weather estimate. Also, we collect the road condition, and then we have a mobile sensor for air pollution. Now, the third study, the real-time Insight COVID India. It's a bi-monthly phone survey tracking the LASI-DAD household for 9 rounds. The sample was randomly selected 1 male and 1 female from the household. Starting in round 3, the LASI-DAD respondent were invited to participate. So roughly, for each round, more than 2,000 respondents interview were done. A total of 15,000 survey was done for all 9 rounds. In this graph, here is a graph to show the timeline for each round. The red line is the COVID caseload, and the 9 rounds are the 9 gray bars. As you can see, the 9 rounds of the RTI COVID India cover the 3 waves of the COVID. The round 1 starting in May 2020, when the first wave of COVID started. The last round was ended on April 2022. The RTI COVID India protocol covers various COVID-related topics, such as COVID awareness, knowledge, symptoms, their diagnosis, vaccination status. We also collect the information about economic impact, health impact, and mental health and cognition questions. Here's a recap of the 3 studies of the LASI-DAD family. It summarizes the sample data collection information from the previous slide. As you can see, LASI study contains more than 73,000 older adults from all the state and union territories. The sample is age 45 and older adults and their spouse. For the LASI-DAD, it's a subsample from the LASI, and then it collects about a little more than 4,000 older adults, age 60 and older. For the RTI COVID India, it's a bi-monthly phone survey from the LASI-DAD household. It contains 9 rounds of the survey, and the sample is age 18 from the household member. In this flow chart, it gives you an overview of how sample was selected. We used 2011 census information to select the LASI sample. The LASI-DAD sample was selected from the age 60 and older from 18 states. And then we have 4,096 respondents from about 3,300 households. For the RTI COVID sample was based on the LASI-DAD household. The interview was conducted in about from 2,700 households for the RTI COVID India. Now you know all the information about 3 studies. I'll be showing how to access the data and then documentation. Here's our LASI website. On the top of the page, there's a data tab. After you click the data tab, it will direct you to our Gateway to Global Aging website. This website is a platform and depository for aging population survey around the world. You will need to register as a user to download the dataset. The the link is on the top right of the website. After you click the download page, it will direct you to our download page website. So it will take you to this core data download page. It shows all the study we did, all the survey we work on, and then around the world, and then so you can see the LASI by putting the red circle. In this link, we provide the link to the download survey data, also data access instruction if you are not sure how to access the data. We also provide the link to download the harmonized dataset and harmonized codebook. If you click to link to the download the survey data, it will direct you to the LASI data download page. This is the download page for LASI. On this page, the first section is for raw data. The data package includes cover screen data, household data, individual data, including the biomarker, also the documentation, including questionnaire, user guide, and raw data codebook. We provide a different format of the data, such as data, SAS, SPSS, and R. The bottom section is the data for harmonized LASI, harmonized data. The data package including the harmonized data, codebook, and study creation code. So some of you probably is not familiar with what is harmonized data. So I will give you a brief introduction of what's the harmonized data set. So harmonized data is a user-friendly, easy-to-use file that contains the clean and summary measures. The file is in respondent level, so each record is in respondent level. The file also contains the imputation for economic variables, and for LASI, it also contains the imputation for cognition variable. For harmonized LASI data, it contains more than 1,400 derived variables, and we also match with the spouse record. For the documentation, I will show you an example later. So it will show you the overall statistics for each variable, and then we show the detailed information about how we create the summaries measure, and then highlight the difference between the harmonized variable and other harmonized study. Also, we list out all the raw variable. In the data package, we also including the data creation code. Now, this is the LASI-DAD website. After you click the data link from the drop-down menu, it will direct you to the data download page. So this is a drop-down menu. In here, you can click the data. It also has a different function. You can also look into all the study detail like study design, and then the publication already, related to this study. After you click the data link, it will direct you. This is the data download page. On this link, it shows you that for the LASI-DAD data, it will direct you to the gateway to Global Aging website. In this page, it also shows you where you can access to our genetic data file. It was available to download in the NIGAR website. It's a government hosts the genetic platform. Now, this is a website for downloading the LASI-DAD data. In here, we have a study detail and then also the link to download the harmonized data and harmonized COVID. So this is a download page for the LASI-DAD. Similar to the LASI page, on the top section is the raw data download, including the data package, including the cognitive test, informant report, and physical measure, and also the VBS assay. For the harmonized LASI-DAD, the data package including the harmonized data, the code book, and then data creation code. Now, this is the website for LASI COVID India. Here's the link. After you click the link to download the data, it will direct you to the download link. And here is the link you can download from the LASI COVID India. The data package including a data that incorporate all 9 rounds of data into one single file. And it also accompanied with a code book for you to understand what's the variable inside the data set. Now I'm going to show you what the harmonized code book will look like if you've never seen it before. So as I mentioned before, the harmonized code book, first we will include a brief overview of the statistics for each variable. It shows the mean, standard deviation, minima, and maxima. If it's a categorical variable, we will show the frequency, including the spatial missing code. In the how construct section, it describes how the variable was created and if there is any assumption has been made in the creation code, in the creation process. For the crossword difference, we highlight any difference from other HRS family study. For each variable, the last we will also list out all the raw variable that used in the for creating the summary measure. Now I'm going to show you some of the example. So how to merge the data file across the studies. So let me show you first example is in the individual level. As I mentioned before, the study was conducted in the household level and individual level. And for the COVID study, there are some variable only collect in the household level and some variable only collect in the individual level. So the first example is just to show you how to do the analysis and then creating an analysis file on the individual level. So first, let's load the COVID data. So use COVID underscore India underscore version 8 is the data after you download the file name that after you download the COVID India data. And then there's a variable called start_dr that will equal 1 that indicate that's the LASI-DAD respondent only. As I mentioned before the COVID, the LASI COVID India, it also contains the household member. So not all the record are the LASI-DAD respondent. So use this as start_dr equal 1 will select the LASI-DAD respondent. Also, we need to rename the ID in order to merge the LASI and merge those three studies together. So we rename the prime key is the ID. So we first rename the variable, and then we generate a new prime key to be same as the prime key in the LASI and LASI-DAD study. So the first 15 digits will be the same, will be the ID we'll be using to merge the other two data sets. So now we can use this prime key to merge the LASI-DAD, and then you can keep the variable you want to use. The two variables I include is R1 CDR underscore final. That's the dementia status variable we obtain from the consensus clinical consensus diagnosis, and then also the MMSE, the total MMSE score. So after you merge it, and then you can only keep the record that they merge on both data sets, and then you can drop the underscore merge variable. Then we can merge with the main LASI survey, because LASI survey contains a lot more health condition variable. So in this example, I merged the Dr. average diagnosis variable from the LASI main core study, like average diagnosis for the high blood pressure, and then the diabetes, and then our lung, average diagnosis with lung disease, and then heart disease. So those are the variables I try to merge with the previous data file. After you merge all three, you can save the data as analysis file. So this is the example of how you merge across three studies for the individual label. Now let me show you how to merge the file in household level. In order to do the household level analysis, you need to first clean up the file only contain the household information per record. Because our harmonized data is in individual level, and then the household information will be repeated within the same household for each individual. So we use so first we load the LASI data, and then keep the variable we are interested in. In this example, we are interested in the like the total income, HH1I total, and then the consumption total, and then also the HH1, HHIS is the number of respondents in the household. Also, the HH1A total B is the total assay in the household. So we're keeping this economic variable in the LASI data set. And then we need to create a household level file. So we drop the duplicate record by using the HHID. That is the household ID. Then we save the file as LASI underscore vars. That's the household level data file. Contain the variable we want to use. Now we can load the COVID data now. And then we can merge the file, the LASI var file we just created, contain the household variable using the household ID to merge with both files together. But in the COVID data, because we still keep the individual level, so that means within the same household, there are multiple records within the household. So that's why we need to use merge n semicolon 1, because we have multiple records from the COVID data, but in the LASI var data, each record is represent each household. So using the merge semicolon 1, and then the ID is HHID to merge both data sets in the household level. So now I'm going to show you some of the research questions that our previous research has already been done. So how was economic impact of the COVID-19 pandemic in India? In this example, I use the income, the question in the COVID RTI COVID India. The variable I use is the income information we collect before the pandemic, and then also we collect information at each run. So I take the difference and then see the change in the household income by run and do this graph. So as you can see, the income dropped almost more than 50% after lockdown in the round 1, but followed by a sharp rebound in the following rounds. Especially in the round 8 and round 9, you can see the income already recovered. But we also interesting to see how the change in different socioeconomic, demographic and socioeconomic groups. So this graph shows the change in income by age, education, gender, income quartile, and urban and rural. So the red dot is the pre-pandemic, and then the yellow dot is the data from the round 1. So you can see the post-lockdown income loss greatest is among the richest household. That's in the Q5. And also the education, the best educated group, also occur the most income loss. Now this graph shows the comparison between the pre-pandemic and round 4. The same pattern we can observe here. So persistent income loss concentrate among the richest group and then also the best educated group. So this is the example that I'm prepared for today's webinar. There are many other more research topics you can look into, and then also using the 3 data files. So if there are any further question, I will take in some question now, and then if you have more questions that you occur later, then you can send us an email using help@LASI-DAD.org. So we received a first question. So the question is, I think the LASI-DAD is a cross-sectional form. It's a data available for wave 1. So only aspect of cross-sectional data analysis are capable on this. The LASI-DAD only cover on the aspect of dementia and related aspects. So is it true that subset of a whole LASI wave 1 cover different sample? So I'm not really get the question. So let's see.
Sandy, maybe I can help out. My understanding of the question was that I think it's asking whether LASI-DAD is a true subset of the whole LASI, or it tried to, like, did it randomly sample the entire LASI sample, or did it focus on particular states or demographic characteristics inside of the LASI sample?
I see. Yes. Thanks for clarifying, Justin. Yes.
Certainly.
Yeah. So so the answer to this, yes, the LASI-DAD, because we focus on the index of cognitive and then dementia aspect. So we do have a specific sampling strategy for selecting the LASI-DAD sample. You can refer, if you go to our LASI-DAD website, a paper has been published for the LASI-DAD protocol. And then we have 3 multi-stage sampling selection for the LASI-DAD sample. And then it's based on their, we construct a cognitive score based on the LASI, the question from LASI survey. And then we select the specific group, to oversample the risk sample. We think they are a risk sample for the dementia. So for all the detail, you can refer to our protocol, the the paper has been published, and then for all the detail. So the next question is, can LASI be harmonized with other aging dataset like China, UK? Yes. So our Gateway to Global Aging website is the website that show all the study. As I mentioned here, so we create a harmonized data set. Okay, here. So we create a data set for all the survey right now is available for almost like 30 different countries, like 11 different survey. So we do have a harmonized, like similar, like harmonized LASI data for Charles as China, and the other like the LSA is for the UK. So the data is available on the Gateway to Global Aging website. So the next question is, how does LASI-DAD has a measurement for both indoor and outdoor PM 2.5? So first, let me talk about indoor. So as I mentioned, we collect the information using the mobile sensor to collect the air pollution. So in the wave 2, currently, we send out the pollution monitor to each household. That some of the household has 3 pollution monitor, and then some household has 2. So we have this pollution monitor. We work with the University of Michigan, and then in the monitor it will stay in the household. One is in the kitchen area, and then one we also as respondent. I mean, for the pilot, we as a respondent to wear the monitor with them for at least 24 hours. So that's how we collect the indoor pollution, and then. So we analyze the filters, send back to the lab. And for the outdoor pollution, so we work with a researcher from UK, and then he mainly work with the WHO to collect the satellite pollution information, and then also the ground monitor the pollution estimate. And then they build a model to provide a model the estimate based on both estimate from satellite and the ground monitor. So we use that measurement for the outdoor PM 2.5 estimate. And then we use the GPS information to map the location with our respondent. So that's how right now we are working on some analysis and to see how the pollution affect the cognitive status. So the next question is how to apply or attempt the data of the whole genome sequence data in LASI. So as I show in the page that we have a link for the NIGAR website here. So after you click a link, it will direct you to the government host the genetic data depository website, NIGAR's. And then it will have all the detail how you can apply and then to get the access for the whole genome sequencing data file. So the next question is, when you say the DBS data will be released soon, can you give a rough estimate how soon can be? Yes. So for the DBS data file, we have been working on and then do the calibration with the University of Washington. We work with the University of Washington, and then also some other department just to do the calibration to make sure the DBS. Oh, also sorry. So the DBS will be the calibration will be. I mean, to make sure the assay is comparable with among other study like HRS, and then for the LSA. And then right now we already finished the calibration, and then we send the file to IIPS, and then we need the Indian government we need to get approval from Indian government in order to release the data. So I would say it's pretty soon in the next couple months, hopefully by the summer. That's the earliest, I think. So the next question is there any hands-on training workshop available for this kind of harmonized data? We provide a hands-on workshop at IIPS last November. We can do more planning if you think it's really helpful for your group. We can organize some hands-on workshop based on your need. It's totally we can arrange those workshops. So we can make some planning and then we can make some arrangement and then to help the research group. Yes. Okay, I think I answered all the questions. If you have any additional question that I haven't answered yet, so again, you can send us an email. We will try to answer as soon as possible, probably within 1 or 2 days. And then also, I encourage you to register our Gateway website and then to explore all the different features that we have really great feature. And then we are going to launch an even exciting website for our Gateway website. You should definitely visit that. I mean, to see our new website. And then also I encourage you to go to each of our study site, the LASI, the LASI-DAD, and then the LASI COVID. And then the website contains a lot more information that if you still cannot find the information you need, you can definitely send us an email and then we are happy to help you. And then, yes, and then also you have like for the, if you want to familiar how to use the harmonized data set, you can also, we have a previous recorded webinar. You can go to our Gateway website. It's under the documentation. So in here, you can see we have the documentation. And then in that website, you go to that link and then we have a previous recorded the webinar, including other the really useful, like how to use the harmonized data and then how that other feature of all the study we have been harmonized. So it's really helpful. Like if you cannot find your answer, you can also look into the recorded video and then the slide we did for the previous webinar. So I think that's it for my presentation. I hope you enjoy it and then you think it's helpful. And then, yeah, don't hesitate to send us an email if you have any question. Thank you.